Hello, everyone. My name is Kevin Kiley. I'm the Communications Director with the UW Clinical Trials Institute. And thank you all for joining us today. We're pleased to be joined today by representatives from the OutReach LGBTQ Community Center here in Madison for this important discussion. I also want to welcome Naomi Takahashi of the Diversity, Equity, and Inclusion Department at UW Health and the UW School of Medicine and Public Health. As we move along today, please feel free to drop questions into the chat or the Q&A section. We'll have time for questions at the end. And now I'll hand it over to Naomi to speak about UW's partnership with OutReach.
Thank you so much, Kevin. Thanks for having me here today. Like Kevin said, my name's Naomi Takahashi, and I use pronouns she, her, and hers. And I am the Director for Diversity, Equity, and Inclusion at UW Health and the School of Medicine and Public Health. I'm super pleased to speak on behalf of our DEI and our community relations departments during this Pride Month about our partnership with OutReach, the LGBTQ Community Center for Madison and Dane County. At UW Health, we continue to work in partnership with OutReach by providing funding on a yearly basis for OutReach's critical work, supporting the needs of our LGBTQIA2S+ community. In addition to this partnership with OutReach, I also wanted to bring critical attention to the many web-based trainings available on our ULearn platform at UW Health, where you can learn more about pronouns, documenting sexual orientation and gender identity in EHS, and also meeting the healthcare needs of our transgender, non-binary, and gender non-conforming diverse patients, just to name a few. UW Health is also incredibly proud of our multidisciplinary gender services program and our pediatric adolescent transgender health clinic that provides the affirming care and support our transgender, gender expansive, and non-binary adults and children deserve. We're also proud to be named a leader in LGBTQ healthcare equality by the Human Rights Campaign Foundation, and we're the only Madison area-based healthcare system to receive this designation. You can learn more about all of this at our gender services programming and leader designation on UConnect or at uwhealth.org. So without further ado, I'm so pleased to introduce Christy Mason and AJ Hardy from OutReach as today's session facilitators. I'll turn it over to them to give their own introductions. AJ and Christy, welcome.
Well, thank you, Naomi. It's nice to be here. I want to say welcome to everyone to LGBTQ 101. A presentation of OutReach LGBTQ Community Center, Madison and Dane County's Community Center for the LGBTQ community. My name is Christy Mason. I am, my pronouns are she, her, and hers. I identify as a cisgender lesbian, and throughout this presentation, we'll be folding in elements of our own personal experience as well as some information about the LGBTQ community and how we self-identify. I'm an advanced practice social worker. I work with elders, and that just means anybody over the age of 50. And we say over the age of 50 because if you're over 50, you remember what it was like to be heavily closeted and to live in fear of being outed in ways that that people under the age of 50 may not be as cognizant of. And so I'm going to let AJ introduce themselves, and then we'll move forward with the presentation.
Hey folks, my name's AJ. My pronouns are he, him, and they, them used interchangeably. So the appropriate way to honor that is to use both sets, not to pick whichever one is most comfortable, but to use both. And I am the program director here at OutReach. I have my PhD from the University of Wisconsin-Madison in anthropology, but through a very winding academic road, wound up actually doing a lot more social service work than the kind of biology and anthropology that I was actually trained in. I've been working here for a little over a year, and just so that you know the perspectives that I'm bringing to the presentation, I'm a transmasculine non-binary person.
So let's talk a little bit about what we're going to talk about. So an agenda for today's presentation would include the power of labels and why is it important to honor the ways in which LGBTQ individuals self-identify. We'll talk about social privilege and intersectionality and how that comes together to form, at least in part, our identities as LGBTQ plus individuals. We'll talk about sexual orientation, sex, and gender, their definitions, what's the difference between these terms. We'll also do the same with gender identity and expression and talk a little bit about our trans community, and then we'll talk about the coming out process and sort of what that involves. Coming out is pretty well known to most people, but maybe we'll give you some new information that you didn't have. Then we'll talk about discrimination and mental health and how minority stress has impacted the LGBTQ plus community and continues to impact the community. And the last two things we'll talk about will be, what does it mean to be an ally, and how can I be an effective ally, and how do we create affirming spaces, not just LGBTQ friendly spaces, but LGBTQ plus affirming spaces, and there is a difference. So first, I'm going to talk about the power of labels and why they're even important. And a lot of people wonder why they're important. And it's because the ways in which we choose to identify ourselves, those words have a lot of power. They can be a double-edged sword. So they can, on one hand, be inclusive, and they can provide a common language for a shared experience. As I know, I felt when I came to my first lesbian coming out group, it was like, oh, I found a place where I can just be. And that reduces isolation, alienation, loneliness, and depression by defining the characteristics of a group. But the flip side is those labels can be exclusive. They can, and as we see this in the popular culture and in some of the legislation that's out there now, those labels can provide a basis for invalidating the lives and experiences of others. And that studies show just increases isolation, alienation, loneliness, and depression by othering groups. So, like I said, self-identifying is a subjective process. It's an internal, complex, very personal process for the LGBTQ plus community. We each arrive at our ways of self-identifying in our own unique ways. There are no two common paths. In the past, some of the ways in which we self-identify were some of those terms were highly stigmatizing. The word queer, I remember when I was 17 and my mom asked me if I was a queer, and it was 1975. I barely knew what that was. I knew I was different, but I also knew that it was not okay to be queer. It was dangerous. It was not safe. And so, of course, I vigorously denied, having any relationship to being queer, and stayed in the closet for another 20 some years because it felt so unsafe to me, and so stigmatizing and so shaming to self-identify as LGBTQ plus. The other word that can really has really been used against the community is homosexual. And in fact, that term until 1973 was a medical diagnosis. A doctor could put that in your chart and get us committed to mental institutions and subjected to treatments against our will, highly damaging treatments against our will. Now those words have been adopted by the LGBTQ plus community and are used as labels of honor. The thing I would kind of state is, when you're working with someone who is over the age of 50, the term queer may still have some negative connotations. So it's always a good idea to kind of check and see, how that person would like to be identified, if they want to be, if they want you to identify them as belonging to the LGBTQ plus community. So the ways that we self-identify are always evolving. They are different now than they were 5 years ago. They will be different 5 years from now than they are today. And that just means we all need a commitment to ongoing education about the LGBTQ plus community. And like I said, it's a personal process, and it's not a good idea to assume someone's gender or sexuality based on their appearance, their voice, or their other characteristics. Just because I choose to show up in the world, I can pass for a straight femme woman, and but that doesn't mean that someone should just assume that that's who I am. Keep in mind that there's always that the individual's way of self-identifying that needs to be honored. And when they do disclose how they self-identify, it's a sign of trust, and it's a sign that they feel safe, and they're asking you to honor what they've disclosed. So we all come together in our own unique ways, and social privilege and intersectionality are two ways in which we do that. Social privilege, as many of you are already aware, just refers to benefits that an individual has by way of belonging to certain social identity groups that have different forms of power. But that privilege often comes at the expense of minority groups. They are disenfranchised, and then we have that privilege at their expense. Having social privilege doesn't mean a person hasn't had difficulties in their life. It doesn't mean they haven't suffered. It means that they may have advantages that just by virtue of other factors that people in minority groups do not have. People can experience privilege due to one of their identities and discrimination due to another. I'm a good example of that. I am a Caucasian person, and I experience a great deal of privilege based on this color of my skin. But I have been outed as a lesbian in places where probably shouldn't have been, and have been discriminated against because of that. So we all have those different parts of our identity, and we're all very complex human beings. So this is our Check Your Privilege bingo. And if you want to get a sense of how your areas of privilege, how many areas of privilege you may have, these are just some of the areas. Take a look. I have a standard accent. I'm white. I was born in this country. I'm not a redhead. I have no speech impediment. I have many, many forms of privilege. And I would get a bingo pretty quick if we played this game. So what we'll do is we'll send this PDF out to you after today's presentation. And if you'd like to take a look at it again, you're certainly welcome to do so. So intersectionality, on the other hand, refers to overlapping forms of discrimination. And that's based, again, on social identities, race, gender, sexual orientation, ability, education. So you see these circles that are overlapping over here in the right-hand side. That is the ways in which these circles intersect, kind of is a graphic of how our differing identities intersect to create each of us as a unique human being. No two people have the same unique or the same combination of intersecting identities. That makes every one of us gay, straight, lesbian, bisexual, transgender. Each of us is a unique human being. So intersectionality considers the interactions of the discrimination and privilege, and doesn't just break them apart separately. So intersectionality says, please look at the way in which these factors overlap and take that into consideration. Intersectionality is an important way to understand the experiences of people within the LGBTQ plus community. Like I said, we are a very diverse community, probably more diverse, with more diversity within the LGBTQ plus community than within the community that surrounds us. There is no one universal LGBTQ plus experience. For example, the discrimination that a trans woman of color faces is going to be very different than that of a trans man who is also, who happens to be white, despite both of them belonging to the transgender community.
So building on now our understanding of intersectionality, we're going to add some definitions and a deeper understanding of the diversity of gender and sexual orientations within the LGBTQ plus community. Sexual orientation simply refers to who we're attracted to, how often or intensely we feel sexual or romantic attraction, and the conditions under which we experience sexual or romantic attraction. And a lot of these terms are familiar to us: gay, lesbian, straight, bisexual. Others may be less familiar: asexual, aromantic. And this is one of those really important areas, like Christy mentioned, where we need to keep investing in learning as people use new terms to describe their experiences. And I want to be really deliberate about that language, right? We're not changing or choosing who we are, we're choosing the words to describe who we are. So that's the important piece there, is that it's about the language that we use and that resonates with us as individuals when describing our experiences. It's not necessarily a choice of experiences, if that makes sense. Sexual orientation is completely distinct from gender identity, gender expression. And as Christy mentioned earlier, queer is a term that you will hear a lot of folks use. I use it myself when I'm talking about my sexual orientation as an umbrella to kind of just encompass anything other than heterosexual. Again, it's important to note here too that a person's past or current partners do not define their sexuality. So a bisexual woman in a heterosexual relationship with a man is still bisexual. A pansexual person in a relationship with someone of the same gender is still pansexual. They don't automatically become lesbian or gay. So this is an important thing, especially if we think about in medical settings where we're taking people's clinical histories and things like that. It's really important to acknowledge that the terms that we choose to describe ourselves are incredibly important and have a lot of meaning and may refer to things outside of the current experience that, someone views us in. Sex, again, is distinct from sexual orientation and gender. And this one, really, when we think about sex, it's just what we're assigned at birth by medical professionals based off of genitalia or other sex characteristics, oftentimes not based on chromosomes at birth because we're not doing that type of genotyping. But that's the assignment of male or female or intersex at birth. And that also is distinct completely from sexual orientation and gender. Intersex is an umbrella term for a variety of conditions. So it's either physical, genetic, etc. For folks who don't fall into the binary categories of male or female. And intersex is a fairly common condition. It's around, or comparably to what people perceive it as, around 2% of the population is born with some type of intersex traits. And that's comparable to the number of people who are born with red hair naturally. And it's important to note that there are a lot of myths that impact the intersex community. The first being that everyone's born either male or female. There are, again, like I said, around 2% of folks who are born intersex. One of the most pervasive is that being intersex is a condition that needs to be corrected. So in this case, we would see people performing corrective surgeries on folks at a really young age. And that's something that is kind of a remnant of this heteronormative, cis-normative idea that everyone has to be either male or female, that there's no room for the natural biological variation that exists in our species in humans. And then the other is that intersex people are transgender. So intersex people can be transgender, but not all intersex people will choose the word transgender to describe themselves, will be transgender. Plenty of intersex people are cisgender. And the other is that no one is speaking out for intersex people. There is a very active and vocal community of intersex activists who are out agitating and advocating for themselves and for their rights. And especially around some of these processes like those corrective surgeries, there are a lot of intersex people who are really mobilized to try to end those surgeries being performed on people before they have the ability to kind of discover who they are, consent to things in that way. Gender, as I've said before, and you will probably hear me say many times, is completely distinct from sex and sexual orientation. I'm going to really hammer home that these are separate phenomena, separate terms. Genders are subjective, socially mediated roles, expectations, behaviors, expressions, and identities. We are socialized from infancy, as we are kind of enculturated and taught all of the norms of our society, we are also taught those gender norms, subconsciously or consciously, by the people around us. So we grow up thinking that there is an ideal or a normal gender role. But those expectations and roles vary from culture to culture, even nowadays. And what we often see in the US is reinforcement of what's called the gender binary, which would be a system of classification in which everything is either male or female, masculine or feminine, with nothing in between and nothing outside of that binary. When we think about how we conceptualize gender, it's also really important to sort of break ourselves out of this habit of binary thinking. When we think about a linear view of gender as a continuum with masculine or male at one end and feminine or female at another end, that still enforces the idea that those are the two kind of furthest limits of expression, that someone's either going to be wholly male, wholly masculine, or wholly feminine, and then everyone else is kind of potentially in between that. But really, if you think about people's individual experiences of their gender, it's much more similar to kind of an like amorphous blob amoeba type of thing, right? It's a non-linear view is much more appropriate to thinking because it's a constellation with infinite variety. So without a binary, without extreme ends of a continuum, it's people existing outside of, completely apart from that gender binary. So we need to kind of, again, make room in our minds for encompassing the infinite variety that exists in gender expression, gender identity. And to get into what those two distinct terms mean now, gender identity, and again, I want to be really deliberate here too. Most often, I will just talk about gender. I talk about gender identity when I'm distinguishing it from gender expression as two separate phenomena. But when you're just talking to someone, most oftentimes it's appropriate to really just talk about gender and to not say gender identity, unless you're distinguishing it from gender expression. But our gender identity is an internal and personal thing. It's how we understand and experience our gender in relation to the ways that we've been enculturated, the ways that we've been taught and brought up to think of gender norms. Gender identities would be things like cisgender, transgender, genderqueer, non-binary, and a whole host of other terms, some of which we'll go into in a few different slides. And again, I want to emphasize here, though, that gender identity and gender expression are not synonymous terms. Cisgender is a term that I want us to all get really comfortable using if we're not comfortable doing that already. So the majority of people in the United States, the majority of adults, are cisgender, which means their gender identity matches the sex that they were assigned at birth. So the vast majority, 98% of the United States adult population is cisgender. And we want you to use the term cisgender and to especially use it when you're working with people in the trans community, because for me personally, always having to put an adjective in front of my gender is alienating when everyone should have an adjective in front of their gender, right? We have cisgender or transgender. So it's inappropriate to use things like normal or non-transgender because that implies that being cisgender is the default and that trans people like myself are somehow abnormal, when in fact we have existed as long as there have been humans with cultures, and we will exist as long as there are humans with cultures. The other important piece of understanding cisgender identity is the idea of cisgender privilege. So cisgender people experience benefits because the gender that you were assigned at birth matches what you express, what people assume that you are in public. So cisgender people can very often use gendered restrooms or other public facilities without fear of verbal or physical harassment or abuse, unlike a lot of transgender people. Trans or transgender is an umbrella term for folks like myself whose gender differs from the sex that we were assigned at birth. It includes people with binary transgender identities like trans men and trans women, and also some non-binary and genderqueer people. When we talk about the process of transitioning, we're really talking about accessing gender affirming care. So affirming the identity through social, legal, medical, and or surgical processes. But transitioning in the kind of traditional sense of the term is not something that is necessary in order for someone to be transgender. All it takes is someone's recognition and use of that label and acceptance of that part of themselves in order to make them transgender, right? It's using that word to describe our experiences. It is being transgender. It's not being on hormones or changing your name or gender marker on your identity documents or anything. It is simply existing that makes us trans. Gender dysphoria, this is an important one to distinguish here, is a feeling, and also in this context, an important one I say because it's a clinical diagnosis. So gender dysphoria is just the significant stress that a lot of trans folks experience because of the incongruence between the sex that we were assigned at birth and our gender. It can cause depression, anxiety, thoughts of self-harm or suicide in trans people of all ages. But it's really something that, especially for me, I most encounter most frequently because it's a clinical diagnosis that I was given so that I could have insurance coverage of my gender affirming care. So it is both a feeling and a medically necessary diagnosis in order to have insurance coverage of your care. And that can make it really complex for folks to navigate. And I remember, when I was getting my letters for surgeries or things like that, going through this process with my therapist of talking about, I do feel feelings of dysphoria quite a bit, but that's a different feeling from being diagnosed with something that is then part of my medical history that I'm then getting treatment for. When in reality, it's just the treatment that I need to feel comfortable in my own body and in my own skin. You heard me use the term non-binary to describe myself earlier, so I said I'm trans-masculine non-binary person. Non-binary and genderqueer are both umbrella terms that refer to folks who exist outside of or beyond the gender binary. So that means folks whose expressions are neither strictly masculine nor feminine, or whose identities are neither strictly masculine nor feminine, a combination, multiple at the same time. There could be flowing between genders or not identifying as any gender, really, not having that resonance and that sense of this term defines my experience when you're thinking about some of these traditional gender terms, and that would be agender. Genderqueer and non-binary folks like myself may or may not consider themselves to be transgender. I think it's important here to listen to the words that people use to describe themselves. I use the word trans for myself all the time, which often gets me mistakenly identified as a trans man, which I am not. I'm a trans masculine non-binary person. And so listening to the way that we describe ourselves is a really important clue there. And you can, sometimes, gently, politely ask for follow-up and say, you've indicated that you're non-binary. Do you also, use the word transgender to describe yourself? Things like that. But it's really important there to remember the distinction that just because someone uses a term like non-binary, genderqueer, or some of these others, they may or may not, also use terms like transgender. Gender expression, again, is a separate phenomenon from gender identity, and that's how we communicate through our clothing, voice, or other perceived characteristics. And this can be something that's private and internal, to the point of like, if we all live in Wisconsin in winter, if you paint your toenails in the winter, no one's going to really see it except you and the people that you choose to have see that. And so that's an example of something that would be private. It could also be the way that you think about yourself internally, things like that. And it can be public, the way that you style your hair. The way that I get my hair cut is a pretty big indicator to folks that, I am on the masculine kind of side of things. Same with Christy, as she mentioned earlier, being feminine, having longer hair is a piece of that. It's the way that people perceive us. But it is really, really vital to remember that gender expression does not always signify gender identity. So it's a situation where we want to make sure that we are, again, listening to people, listening to the words that people are using to describe themselves, and remembering that just because someone has facial hair, that doesn't mean they're masculine. I know plenty of trans women who've decided to keep their facial hair either for, you know, emotional, social reasons, or because of the reality that a lot of those treatments to remove facial hair are really expensive and painful. A non-binary person may wear feminine clothing. They may only wear, you know, things that we would traditionally think of as being feminine or masculine and not express androgynously. And that's absolutely okay. Gender expression, again, does not always signify identity. There are lots and lots of cisgender women out there who have short hair and wear masculine clothing. So it's something that we can do to make ourselves feel better. It's something that we can do to signal things to other people, but we also want to make sure that we're breaking down those habits of always assuming certain things because of people's appearances. So again, it's just about listening. It's about listening to how people are describing themselves and how people are showing up in spaces.
Okay, so we've defined some terms, and now we'll talk a little bit more about the coming out process. So everybody knows, or most people know, that coming out is the process by which someone accepts or comes to identify one's own sexual orientation and or gender identity. So I came out about 20 years ago. And for me, it was, and for many people that I know, I don't want to generalize to the entire community, because that wouldn't be, that would be putting everybody in the same box. But for me and for a lot of people I know, there were two processes. One was coming out to myself, and that took a long time. And then once I finally came out to myself, it took me another couple of years to get comfortable enough with my new way of identifying myself and defining myself, and the new sense of reality I had about myself, to then come out to other people in my life. And I was pretty lucky. I didn't lose a lot of people as a result of coming out, but it is can be a two-part process. So people can come out at any age. We see a lot of youth who may wait to leave home before they come out because it's not safe. I talk to people in their 60s and 70s, and I think even 80s now, who have never come out to another human being before and may not have any intention of doing so. They may just decide to stay, just to come out to themselves and not to come out to anyone else, for a variety of reasons. So I think the most important thing is that when we do come out, you know, we choose who to talk to first. And lots of times we choose the people who are that we can most afford to lose first. At least that's what I did. And then progressively, as I got more comfortable identifying as a lesbian and being identified as a lesbian, I came out to more and more people who were very close to me. And that was kind of the way it worked for me. But the coming out process occurs many times for each person. Like, I come out to my friends, I come out to my coworkers, I come out to my medical providers, I come out to a variety of people at a variety of times. And that is just like any other part of identity. We all kind of come to different realizations about ourselves as time passes. But I want to reiterate what AJ said, that it's not that we choose to identify. We come to a realization that this is who I am, and this is what I need to say about myself to make sure that I have some congruence, that the way I manifest to other people is the way I experience myself. And I have that congruence between those two things so that my insides match my outsides. So if somebody comes out to you, that's, like I said, that's a sign of trust. Disclosing someone's gender identity or sexual orientation without their consent is called outing. And it can be dangerous, and it definitely damages or destroys trust. So disclosing somebody's gender identity or sexual orientation can be the prelude to increased violence, increased bullying, and other types of discrimination and stigma. It's okay to ask someone if it's okay with them to discuss their sexual orientation or gender identity. But if you have any doubt, leave it out. If you're unsure about whether or not it would be okay to discuss someone's gender identity or sexual orientation, just default to keeping that information private until you can speak to one side with the individual and see what their preferences are, and then honor those preferences. So the coming out process has both positive and negative feelings and behaviors that go along with it. And I always talk about the negative ones first, because those are sort of the ones we do our best to leave behind when we come out. There is internalized homophobia. That's where we take the stigma and shame and that the LGBTQ, we take the stigma and shame that the cisgender straight community puts on the LGBTQ plus community, and we take that into ourselves and feel that way about ourselves. We feel ashamed of who we are. We feel stigmatized for being who we are. Internalized transphobia is the same thing, except it applies to people who are transgender or non-binary. Isolation, fear, anger, uncertainty, and depression are all negative emotions and experiences that go along with the process of coming out. And you think about young people coming out, oftentimes some of the behaviors that you may see are leaving home because kids have been kicked out, dropping out of school. When a kid leaves home and they have no address, they have to drop out of school. When they drop out of school, they don't have the options to pursue higher education. When they don't get the higher education, they oftentimes don't have the same socioeconomic standing as many of their cisgender straight community members. And they're more likely or more vulnerable to self-inflicted violence, increased drug and alcohol use, and suicidal ideation and attempts. But the good news is that with coming out, there's enormous feelings, especially when connecting with the community, of self-acceptance, connection, relief, authenticity, that sense of congruence. This is who I am. This is how I experience myself. And it mirrors how people experience me in a positive way. And pride, because it's a hard thing to do, but it's a good thing to do, and it's good for us to do. With those positive feelings comes an increased sense of community and reduced suicidal ideation and better mental health outcomes for members of the community. So the silver lining about all of this, we've talked about some of the negative outcomes that LGBTQ plus community members experience, but those negative outcomes really aren't the result of LGBTQ plus people in and of themselves, but they're the results or the consequences of the ways in which we are treated in this culture and the stigma and shame that is oftentimes heaped upon us. So LGBTQ plus individuals are, on the contrary, highly resilient in terms of politics, in terms of how we maneuver socially, and in terms emotionally. LGBTQ plus people are often more well-connected and have stronger support systems outside of our nuclear families because we've lost our nuclear families or we've been estranged from them to some degree earlier on in life. So studies have kind of shown that our social connections are stronger than those, oftentimes than those of people in the cis straight community. So we've talked about the coming out process. Let's talk about discrimination and mental health, particularly minority stress. And that is another piece of the puzzle with how LGBTQ plus individuals show up in the community. Minority stress refers to social factors like discrimination that cause daily stress. That daily stress just builds up over time and can lead to long-term physical and mental health consequences. LGBTQ plus people, and especially transgender people, experience, because of minority stress, experience increased discrimination in housing, education, employment, healthcare, public accommodation, and interactions with law enforcement. And it just becomes a domino effect. And this is a sort of a graphic that kind of illustrates that LGBTQ plus individuals experience that shame, stigma, and discrimination based on sexual orientation or gender identity, and that then leads to poor mental and physical health outcomes. But improving LGBTQ plus mental health by affirming people's identities, by giving trans folks access to the care that they need, that relies on countering the negative attitudes that are in the larger culture and providing culturally competent, affirming care and support. So that affirmation leads to improved mental and physical health outcomes and minimizes minority stress. Affirmation saves lives. So transgender folks who live in states with gender identity non-discrimination laws reported fewer suicidal thoughts and attempts. Trans youth with supportive families have lower risks of suicide. Trans youth with families that use their chosen name evidence less suicidal ideation, and trans adults with supportive classmates and coworkers have fewer suicidal thoughts and attempts. So you've learned a little bit about the LGBTQ plus community, and now let's talk about how to be an ally. An ally is just someone who is not LGBTQ plus, but who accepts and, more importantly, affirms their LGBTQ plus neighbors, coworkers, family members, and friends. And it's about action. It's about what allies do rather than just having a positive feeling. Allies are people who are aware of their privilege, and we've talked about social privilege. They're aware of intersectionality, and allies acknowledge that there are some things that they'll never experience or have to think about because they're not members of the LGBTQ community. Allies use their privilege to advocate on behalf of marginalized communities when needed, and they do that without speaking over the voices of people in the community. And that's the important thing, is an ally helps to create space where those who are marginalized can speak. So if you want to be an ally, use your privilege, create that space for LGBTQ plus individuals to share our community and what it needs, rather than implementing policies or programs without our input. It's like that saying, nothing about us without us. And I think that's really true of the LGBTQ community, as well as other marginalized communities. Listen to and validate the things that people in marginalized groups are saying, and understand that being cisgender and or heterosexual means that you are safe or safer to speak up and intervene in situations where an LGBTQ plus person might be at a higher risk. So if someone makes a joke or a disparaging comment about an LGBTQ plus person, say something. If you witness somebody being bullied, step in. And be aware of microaggressions. So microaggressions are just subtle but offensive comments or actions directed at people in a marginalized community. They are often unintentional and consist of expectations that cisgender or heterosexual people take for granted. So a person might commit a microaggression, and it wouldn't feel like a microaggression to them necessarily, but to the person that's on the receiving end, that's going to feel not safe to them. It's going to feel like it doesn't promote trust, and it's going to feel aggressive, even though it may not have been intended that way. It's still a microaggression. Common microaggressions include assuming that everybody is heterosexual or cisgender when that's just not the case. Verbal or nonverbal cues that indicate discomfort with LGBTQ plus identified individuals, assuming you know someone's pronouns and not asking. It's cool to just introduce yourself and say, my name's Christy Mason. My pronouns are she, her, hers. You know, would you like to share your pronouns with me? And if person's comfortable doing so, golden. Other microaggressions include denying that homophobia and transphobia exist in your community. I have senior centers who say, oh, we don't have any LGBTQ plus community members here. And it's just that the LGBTQ plus elders in those senior centers don't feel safe enough to self-identify. And there are always people who take me aside after we do a presentation and say, I really appreciate this. I'm in the community, and this was really important. And then finally, there's denial of bodily privacy as a microaggression. So we talked about cisgender privilege and how, as a cisgender person, I can walk into a bathroom and not have to worry about getting nasty comments or dirty looks, or attacked and harmed physically. I can go into dressing rooms. I don't have people asking me invasive questions about medical procedures, which some people do with people in the trans community, and ask really invasive questions that are really not appropriate. So those are all common microaggressions. And when you commit one, you just say, okay, I messed that up. You apologize and you move on. And you don't get all bent out of shape and expecting the other person to make it okay. It's your job as the person who committed the microaggression to take those feelings of embarrassment or shame or whatever you would call it, and use those feelings to turn your language and your thinking processes around a little bit. We all make microaggressions. I do it quite frequently here at Outreach, and I have lovely coworkers who let me know when I do. And I've learned to just say, I'm sorry, and I correct myself and I move on, and I let it be a learning experience for the next time. So
when we're working with folks in the LGBTQ plus community and creating spaces where people are not just like safe to exist, but are affirmed in our existence, we need to remember to let people in our community tell our own stories. So if you're supporting young folks, that's creating space for youth and for their families to share their own experiences. It involves educating families and loved ones on how rejection can impact LGBTQ plus family members, pointing out things like about family rejection leading to increased risks for mental health issues, substance use, suicide, all these negative health outcomes that we talked about earlier with coming out. And highlighting the fact that acceptance and going beyond acceptance to affirmation are really important for our long-term health and well-being. It also involves respecting pronouns. And there was a question earlier about working with people who, haven't or are not self-disclosing information. So there's a lot of ways that we can kind of create space for people to feel safe enough to self-disclose. So that means using gender neutral pronouns for someone until until someone discloses that information to you, or just using an individual's first name, which can sound clunky and kind of awkward when you do it repeatedly because we're used to substituting pronouns in. But if we don't know someone's pronouns and we haven't created a space where we're sharing pronouns, or we're not comfortable asking someone to disclose that information, you can just use their name repeatedly. Gender neutral pronouns are also a kind of safe default. But again, sometimes for folks and especially for folks in the trans community, who have binary trans identities, so it'll be trans men and trans women, always using gender neutral language is actually really invalidating. So we want to make sure that we're creating safe spaces, and creating the room for people to disclose their pronouns to you. And so that can be by doing things like when you introduce yourself, say, hey, my name is AJ, my pronouns are he, him, and they, them. Or putting your pronouns in your email signature or on your name tag if you're at a conference or any type of meeting. It creates space for people to also share, for people who maybe don't have where there's not the assumption that pronouns are correct, right? So, I'm always really deliberate about putting my he, they pronouns on everything, even though most people now assume he, him pronouns instead of she, her, like they would earlier in my life. I still put that he, they there because I use both sets of pronouns. And it's really important to me that people use both in order to kind of honor my existence. But a lot of times for folks, it's not necessarily even about signaling what your pronouns are. It's about signaling that it's a safe space for other people to share theirs. And it's also about showing folks that it's something that is normal to do, that we're not going to make assumptions about pronouns based off of someone's appearance or anything like that. And so I really want to emphasize that again to folks, that it's not even necessarily about, somebody may always look at you and assume the correct pronouns, but we want to make it so that it's a space where people who do, maybe use pronouns that folks wouldn't assume based on appearance, those folks aren't singled out by always having their pronouns listed or always having our pronouns listed, right? In my case, because when I'm the only one that has them listed, it kind of outs me and then also makes me feel super uncomfortable. So it's a lot more about like inclusivity and the safety of a space than it is sometimes necessarily even just conveying that information to people. We also want to make sure that when we're talking about affirming and safe spaces, we are using the names that people give us for themselves. And then we're also making sure that we're describing people in a way that is affirming of their gender and not using incorrect pronouns, honorifics, or other gendered language. So misgendering and dead naming are incredibly harmful behaviors, even when they're unintentional. In some workplaces, I'm not sure about the policies at UW, but in some workplaces, repeatedly misgendering or dead naming someone is tantamount to creating an unsafe work environment and workplace harassment. A lot of places have started adopting this as part of their kind of code of expectations. These behaviors can also out trans people without our consent, which puts us in a vulnerable position and increases the risk of verbal or physical harassment and discrimination. All that being said, as Christy mentioned, mistakes will absolutely happen. No one is going to be perfect on this, and asking or assuming that people can be perfect on this is kind of setting us up for some disappointment, because I'm a trans person and I still use incorrect words sometimes when I'm talking about my friends, or incorrect pronouns. It's me and my brain against 34 years of being raised with certain assumptions. So the best thing to do is apologize quickly, move on. Don't dwell on it. Don't make the person that you've misgendered or dead named or otherwise harmed feel a responsibility to your emotions in that moment. So use your feelings as a learning experience for next time so that you can correct yourself. And then also commit to ongoing education. So seek out high quality, reliable sources of information, and in particular, those that are written by people in the community you want to learn about. So if you want to learn about trans issues, look for work that's being produced by trans people. Same goes to kind of any marginalized community, because there's so much really harmful and dangerous and downright deadly misinformation out there about trans people. So we also need to commit to staying up to date with what's impacting the community where you live. So that can be things like anti-LGBTQ plus laws or policies that are being advanced by school boards or local governments. And importantly, what LGBTQ plus folks in your community are already doing, because it's never a question of, starting from scratch almost anywhere. There are people who are doing the work, who can support the work. And so it's finding out what's going on and how you can support the work that's already happening in your community. So our conclusions that we have, our community is diverse and there's no singular LGBTQ plus experience. We have to make room for that diversity and that understanding. We regularly confront discrimination from various individuals and institutions, and it can seriously negatively impact our health. So providing safe spaces and opportunities for discussion and learning can improve mental health, can lower suicide rates, and can lower rates of substance use in adulthood for LGBTQ plus folks. And creating and maintaining safe and affirming environments for people in our community relies on input from the LGBTQ plus community, and then a good amount of work from folks who would consider themselves to be allies. As Christy said, being an ally is about action. It's not just about, how you feel internally. It's about how you bring that feeling into the world and use your privilege to advocate on behalf of folks in marginalized communities. So I know I've only got a couple minutes technically left, and I want to make sure that we can answer a few questions. Especially since it looks like there's a couple. Yeah, so I mentioned that I use he, they pronouns. And for myself, I always want to, I try to clarify that like folks can use them interchangeably, whether it's using them in the same sentence sometimes, or just switching it up and making sure that, sometimes when folks are referring to me, they'll use he, him pronouns. Other times they'll use they, them pronouns. So I think that it kind of is going to depend on that person, but most people that I know will specify and say like he, him used interchangeably, and that would be grammatically correct in that instance to use both in the same sentence. And to the point of how do you know which one to use? I think again, because I'm telling you that I use both sets, you can feel comfortable using both sets for me. There's also, we have a question about neopronouns. And one of the things, Christy, is the link to the Forge chart about neopronouns on the resources slide?
Let me look.
So there's a lot of really great resources for getting practice, especially with neopronouns, which would be things like z here, z zir, per pers. There's a really wide variety of these pronouns that are just newly introduced to the English language over the last few decades, and that's why they're called neopronouns. I think the best strategy for getting familiar with using neopronouns is both practicing, but also accessing some resources. So we can include a link to an organization called Forge that's based in Wisconsin. They've put together a chart, and so it breaks it down into, the parts of speech and, whether it's a possessive or a first person or something like that. And I think that again, in that case, it's really good to practice. And to the second question there, gender neutral language, I think, is a good alternative when folks have not had an opportunity to share or maybe aren't safe or comfortable sharing. Using gender neutral language as kind of your default decreases the odds that you'll misgender somebody. And again, it's about using that until you've been able to kind of create the space or politely ask, right? Because, I wouldn't want to, well, this is different. I do this training type stuff all the time. So I would be fine being asked my pronouns in front of like 400 people, but we want to make sure that if we're asking, we can say, my name's AJ, my pronouns are he, they. Do you mind sharing yours with me? Respectful language like that, where again, you're not in front of a lot of people. Keeping in mind that people disclosing their pronouns is an issue of safety sometimes. So that whatever we're doing, we're being respectful and we're being mindful of the safety of individuals.